Good morning. So it seems it's time for our conference to begin. My name is Damjan Osredkar. I am a pediatric neurologist from Ljubljana in Slovenia, and I'm involved clinically in this project from the very beginning. And I must tell you that it's a great honor for me to welcome you all here. The story for me started with one family, with Urban, Špela, and Samo. But now the story has expanded tremendously. There's more than 100 families that actually participate in the natural history study. And it's hard to underestimate how invaluable this information is. I understand from talking to you all that it's quite a challenge to travel with children with CTNNB1, but still you come and you provide all this valuable information. And this information, I can tell you, is used in many beneficial ways, so we can understand the disease much better than we used to. If we look at what we were able to discuss about on the first conference, now we have a lot of very interesting stories and we understand the disease much better, but also we are approaching the goal that we are aiming for. We have a very talented group of people working on the project. So there's geneticists who are trying to understand how different genetic variations correlate with the clinical symptoms when the CTNNB1 gene is more active in the development. We have preclinical scientists who not only have developed the vector that we will use in our clinical trial, but who are also trying to understand how this vector is distributed in the human body and the body of our animal models. And we have a group of clinical people and healthcare professionals who are working on separate projects like tethered cord, ophthalmology, MRI, EEG, and so forth, psychologists who are trying to understand the disease. So all this is bringing hope that when the final trial is coming, that we will be able to do the right thing. And we are on the verge now of submitting the clinical trial protocol. It's been a very elaborate work. There's a lot of questions that we need to answer before finalizing this, but it seems that this is actually really happening. You'll hear more about the clinical trial tomorrow, but today I would just like to say thank you all for coming, especially the families. Thank you all the experts that will share your knowledge. And with this, I would give the word to Špela to present.
Yeah. Hi. Yeah. Hi, everyone. It is really, really, really nice to see all the old faces, all of the old faces, the families. I can some of them also call my friend. All of the researchers, the doctors, the examiners that have been helping throughout these years. It is also very nice to meet new families and new children. So last year, some of you also attended the conference in Ljubljana, and it was very, very busy time for me. I didn't have any chance to, just sit and talk and get to know everyone. And so this year, I had a lot of help. So I would just like to take this moment to thank ESTI and the whole Spanish Association, who has been really helping with the whole organization. I want to thank Anna and Bruno, our technical director, and also Laura, who has been really on top of everything. And so because of all of that, I was able to take a bit more minutes and moments to to chat a bit with you and to talk to you. And I have to say it was very, very difficult because, I also have a child and I also know how difficult it is. So seeing all of your struggles have really touched me. I really, really, really hope that we will be soon giving our children a chance to life. So this organization is being organized with the Spanish organization, Asociación CTNNB1, and also with the CTNNB1 Foundation. And during these 2 days, you will be able to hear a lot of our work from the preclinical research to the clinical research. You will also a bit hear on understanding the disease and also on other treatment solutions. To make this conference happen, I would like to thank University Deusto for offering us this place. I would like to thank the Fundación Columbus for sponsoring this conference, and also the Agilent and many of other partners and collaborators that have helped even put the titles you will be hearing today. So the Faculty of Medicine, the Varalgent, Oxford University, our Palčica Pomagalčica, Labina, Sinso, Catalonia Hotels for offering us more discounted prices, Valdebron, the Czech Center for Phenogenomics, the Children Medical Research Institute, the Barcelo for giving us space to taking care of our children, the CIMA, and probably many others not mentioning now. So I would like to say, take this opportunity during this conference to ask many questions, and many questions you may have. Take this opportunity to speak to the researchers, to speak to each other, to connect, because connections are everything. And it's really an amazing opportunity to get advices and experiences from other parents here. So I wish you very informative and very inspiring 2 days. And I'm happy also to chat during the coffee breaks. Thank you.
Buenos días a todos y todas, familiares y profesionales. Good morning, everyone. I will say some words in Spanish and English. Dedicar espacios como este para el estudio y el debate es sumamente importante, sobre todo teniendo en cuenta las dificultades que debe afrontar el abordaje de una enfermedad como el síndrome de CTNNB1. La Universidad de Deusto lleva años comprometida con la investigación en enfermedades poco frecuentes, convencida de que tenemos que ser también un motor de transformación social y humana. En este compromiso, el equipo de investigación Neuromotion ha desempeñado un papel central. Desde hace varios años, este equipo colabora estrechamente con la asociación CTNNB1, desarrollando investigaciones y acompañando a las familias y a sus hijos e hijas afectadas por la enfermedad. We are proud to host this international gathering at the University of Deusto, bringing together leading families, researchers, and clinicians in the field of CTNNB1 syndrome. This community represents an inspiring model of scientific and social cooperation. Through the work of the Neuromotion Research Group, our university has taken an active part in fostering dialogue between science, research, and the lived experience of the CTNNB1 Association. Over the coming conference, we will explore some of the most promising avenues in gene therapy and clinical trials, among others. To all researchers and health professionals, and to all the families, thank you for your support and your passion. Muchas gracias.
And now we have the words from the President of the National Assembly through a video, if our colleagues can help us.
Dear President, Dr. Špela Miroševič, dear parents, researchers, and all of you committed to improving the quality of life for children with CTNNB1 syndrome. Let me begin by warmly welcoming you to the opening of the 3rd International CTNNB1 Conference. At the end of 2024, I had the privilege of contributing a modest share to the adoption of legislation in Slovenia that paved the way for the funding of gene therapy development for children with rare conditions such as CTNNB1 syndrome. I'm especially proud that the legislation prepared by the responsible ministry was passed by the National Assembly unanimously. Through the collaboration of parents, experts from various scientific disciplines, and regulatory bodies, Slovenia has established itself as an example of good practice in the development of rare disease treatment. On a symbolic level, we have also demonstrated to the international community that remarkable progress is possible when all stakeholders who share a commitment to improving the quality of people's life join their forces. Compassion and care for one another must become the foremost guiding principles for all decision makers if we want our civilization to thrive in the long term. Over the past years, Slovenia has taken several important steps in the field of rare diseases. We have introduced a pilot program to support families with children affected by rare conditions, and I hope this initiative will grow this year from a pilot project into a national support program for all families. As I have already mentioned, we have amended the legislation to enable systemic support for the development of gene therapies for rare diseases. Additionally, the Republic of Slovenia has contributed €1 million toward the development of the first gene therapy for CTNNB1 syndrome. Institutional and financial support from the state will continue to play a crucial role as we move into the final preparations for clinical trials. I sincerely hope that Slovenia's story will inspire other countries and the entire international community. I will therefore take every opportunity to share our journey with decision makers abroad and invite them to join similar initiatives. Slovenia will remain firmly dedicated to supporting children with rare diseases, both within its borders and beyond. Ladies and gentlemen, your work and expertise offer the international community far more than just the prospect of treating rare genetic diseases. You bring hope. Hope that through productive collaboration between science and stakeholders from various fields, we can significantly improve people's quality of life. I wish you a successful third International CTNNB1 conference. Thank you.